Every day, millions of South Africans wake up before sunrise, not to work, but to wait. They wait in queues for hospitals, for municipalities, for documents, for services that should be simple. Across government and essential services, citizens face long queues, fragmented service points, and paper-based systems simply to access basic services. People stand at police stations and municipal offices to generate legal documents, submit CVs, pay taxes, obtain proof of residence, resolve land and title deed matters, or apply for permits and licenses. Others carry worn stamped certificates or struggle after losing IDs and official documents. Many are forced to travel long distances to reach home affairs or stand in queues at banks and ATMs for routine transactions. In hospitals, patients wait more than 45 minutes just to open or retrieve files, while record rooms overflow with untidy paper folders, resulting in lost information, duplicated records, and delayed care. This is not a failure of people, it is a limitation of systems. Over the past year, we have designed a system that bridges the digital divide and delivers services at the point of need, where citizens can receive services via mobile, through a booth, or from the comfort of their own homes. Today, a new digital public infrastructure is introduced, South Africa's first digital public administration operating system, the Electronic Microservice Booth. We have successfully completed and closed out this electronic government operating system into 3 fully integrated production-ready platforms. First, Public Citizen Connect, which allows citizens to access services from home, book appointments, track requests, and securely access their digital life course data. The platform is fully developed, back-end integrated, and ready for pilot rollout. Second, the Public Servant Electronic Office enables officials to generate, manage, and process services digitally, reducing paperwork and improving efficiency. It is a combined internal and custom digital government operations architecture that allows officials to focus on serving people instead of handling files. Third, the Electronic Microservice Booth is a physical digital access point that brings essential services closer to communities. It is a fully integrated digital machine, not a screen with a form. It functions as a local digital office, even in environments with limited infrastructure. All platforms operate on a unified back-end architecture, supporting secure department-linked databases, modular institutional software, authentication systems, access control, and end-to-end data flows between citizens and service providers. The booth integrates hardware and software through a modular design powered by a computer controller, touchscreen interface, secure printers for IDs, licenses, and certificates, dual cameras, a QR scanner, a fingerprint scanner, and ID scanner. Documents are generated digitally and, where required, printed securely through the booth, ensuring authenticity and accessibility. The system operates through a secure digital workflow. Citizens submit requests digitally. Requests are routed to authorized officials. Officials authenticate to process, approve, sign, and issue documents. Citizens receive verified outputs digitally or through the booth. Citizens remain in control of their personal data. Access permissions are managed securely. Records are not duplicated. Every action is traceable and auditable. For municipalities, residents no longer need to move between offices or towns to access basic services. Through the Electronic Microservice Booth, multiple government services can be hosted in one accessible location, including payments, permits, licenses, title deeds, service requests, emergency reporting, and selected home affairs services. Citizens no longer need to arrive at Home Affairs offices before sunrise or wait in long queues for basic civic services. Through secure digital access and local service points, essential identity and civic records are available when and where people need them. In healthcare, there is no longer a need to arrive at a hospital at dawn simply to open a file or wait in administrative queues. Patients can queue digitally, generate an electronic health file via mobile or through the booth, and manage their administrative records before arriving at the facility. Nurses and doctors capture patient information, diagnoses, and treatment digitally, eliminating lost files, duplicated records, and manual paperwork. Healthcare workers can focus on care, not administration. In education, learners and graduates no longer need to travel long distances or wait months for academic records. Through electronic microservice booth locations, citizens can securely access, generate, or print certificates, diplomas, and confirmations efficiently and locally. In banking and financial services, congestion is reduced, administrative pressure decreases, and reliance on physical branches is lowered. Institutions benefit from reduced operational costs and improved accessibility, while citizens receive faster services closer to where they live and work. From a technical readiness perspective, authentication and access control are implemented, secure databases are in place, end-to-end data flows are tested, interfaces and back-end integrations are complete, and systems are stable and pilot-ready. This is not early-stage development, it is deployment-ready infrastructure. Because the system was developed using modular design, phased integration, and minimum viable product prioritization, it is ready for controlled pilot deployment, institutional onboarding, and incremental scaling across municipalities, provinces, departments, and sectors. The electronic microservice booth is not just a kiosk, it is a digital public infrastructure. It decentralizes service delivery, removes barriers to access, and modernizes how institutions serve people securely, efficiently, and at scale. We invite public institutions, private sector partners, and investors to join us in building South Africa's next generation of digital public infrastructure. Together, we can reduce queues, eliminate paperwork, and bring essential services closer to every community.